bring in the next human. Hello, human. We'll have to make this a bit quick today. There are a lot of humans that I need to examine. There are a lot of vampires that need blood, and not quite enough humans to feed them. We've had a lot of work to do. I had to skip lunch today, so I'll try to be as professional as possible, even though you are just food. You do deserve a little bit of respect. Let's start with a few questions. How much water do you drink? What kind of diet do you have? Do you know your blood type? Have you ever been bitten by a vampire before? About how much do you weigh? Do you smoke, vape, or chew any products? How much do you think your BMI is? How much of you is fat versus muscle? Do you have any blood-borne diseases? Does anyone in your family have any blood-borne diseases? Is anyone in your family a vampire? How good is your circulation? I'm looking at your thighs right now. Just they feel cold. Do you have poor circulation? Do you take any medications? About how many hours a night do you sleep? Some humans sleep during the day. I suppose they think they're safe. They think all the vampires are resting during the day. You'd be surprised how many attempt to go outside. I deal with a lot of vampire burn patients. Although we get a lot of heat stroke and burn patients during the warmer months, we have a constant battle with malnourished vampires. There aren't as many humans as there used to be. The vampires who are around weren't rationing the blood properly, so now we are a little underfed. Normally, a human like you wouldn't be considered for long-term feeding. That is, we'll drain you slowly, allow the blood to be replenished, and then drain a little bit out again. We'll go back and forth until you've been drained completely by accident, until you become too old that you're unable to replenish blood, or perhaps you'll become sick in that time. No matter what happens, hopefully you last at least a couple of years. The hard part is finding someone who wants to take you. Everyone wants someone with really tasty blood and really good blood replenishment. You seem fairly average. It's going to be at least 14-ish, possibly more days before you're ready to be bitten again. But that's only if they take a very small amount of blood. If they take too much and not wait long enough for you to heal, they won't have you for very long, and they'll be very mad about that because buying a feeder human is not cheap. You'd think hiring a doctor to take care of their humans would be fairly expensive, but that's not what they decided to do. There's also a bit of a doctor shortage. I'm actually a veterinarian, so I'm doing my best here. Humans can't be that different from a cat or a dog. We've looked a bit on the outside, now let's look a little bit on the inside. Please open your mouth, human. I don't see anything too concerning in there. I don't see any bleeding. Can you say ah for me? Good job. Oh, I'm used to working with animals. They're used to getting pets and praises for listening. It's okay, I think. You can close your mouth now, thank you. Didn't see anything that would be concerning. You are going to be a feeder human, so they'll need to feed you appropriately. You will be either tied down or kept in a very tight cage. It won't be healthy. I would recommend a bit of free range. Perhaps a closed-in pen or a proper leash. That way you can get some room and some sunlight. Definitely will need a little bit of that to help with your healing process. But you might not need your teeth, so they could feed you meal replacements, maybe smoothies. Getting ahead of myself. I'll have to focus just on your exam. Let's see. Oh. Let's listen to your heart. The human's heart is typically around this area. Please take a deep breath in, hold it, and a deep breath out. Well done. I'm going to place this on your back. Please take a deep breath in, hold it, and out. I'm going to place this back on your chest. Breathe normally, please. Right, your heartbeat is normal. Don't hear any palpitations. Let's check out the other side and listen to those lungs too. Please take a deep breath in. Hold it. and breath out. Perfect. I'm going to place this on your back. Please take a deep breath in. Hold it. And breathe out. Wonderful. I'm going to place this back by your heart. Breathe normally, please. Excellent. So far, everything's looking good. Lungs, heart sound all right. Nothing too worrisome. In the mouth, felt your limbs, felt around your neck, felt a little bit around your face. Didn't see or feel anything worrisome. Let's try your eyes. I want you to keep your head still, but follow my finger. Follow my finger only using your eyes. Here we go. Good job. You're a lot better than that, than the dogs I practice on. I'm going to cover your eyes. Just watch your pupils dilating. Yes, they are. You're doing a really great job of not flinching. Fortunately, many of the humans that brought in suffered head trauma. Typically, when humans are caught, they're immediately fed upon. Vampires who captured you aren't used to being gentle. It seems that your brain He's doing all right. Now for the part that everyone's been waiting for. I'm going to see where the best place to bite you will be. Vampires typically bite at the neck, but that's when they're only biting you once. They're going to have to bite you multiple times. So we're going to have to find a good spot where you can either be bitten every 2 weeks or so, or maybe we can see if there are more than one spot you can be bitten. Maybe the head. It's not easy to bite the head, but head wounds tend to bleed a lot. They don't clot as fast, so they could really get a lot without doing too much damage. If the vampire bites an arm or a leg, they might keep feeding and overfeed. Safer to go somewhere that is less appealing for the vampire to bite. Yes, we'll definitely avoid the neck area. Too many vampires can't control themselves. The urge will overtake them. Too tempting, too tempting. Perhaps it'd be more comfortable for everyone to go by the arm. Let's see. A bit lower. This could be interesting. No, it's too close to an artery. The vampires won't like it, but they'll have to bite you in a vein and not an artery. They'll have to eat deoxygenated blood. They're not going to like that. It doesn't taste as good. But if they puncture an artery, you will bleed out. Possibly in less than a minute. Stay away from the thighs. Too many possibilities for an accidental artery bite. What about a nerve? What about hitting a nerve? There's a lot of those in the wrist and in the upper arm. Humans typically donate blood in the crease of their arm, but it would be a very difficult spot to bite properly. And it would hurt the human for quite a while. It's not an easy spot to keep biting. Yes, definitely leaning towards the head. An uncomfortable place to be bitten, but the skull would prevent any deep punctures. And the vampire wouldn't enjoy it as much, so they wouldn't feed as much as they would like. seeing some spots that I would like to consider. I'm thinking right by the ear and jawline. There's an artery right here, but if they bite high enough to completely miss that, they can get a good grip here, but again, not enough to keep drinking. Perhaps up by the forehead. Up here. The hairline might get in the way, but again, that's a good deterrent. So I can see that there perhaps towards the back. No. Too close to the spine. Let's avoid the spine. Another potential area is maybe a shoulder. You can see that. The shoulders, perhaps. Shoulders and head. Very good. I'm comfortable putting that down as potential bite marks. Once you're done with me, you will head out and you will be bitten. Not by me, unfortunately. I'm far too busy. You'll be bitten by a potential buyer. They'll want a little bit of blood to taste before they purchase you. I'm going to clean up the spots that I think will be the best places to be bitten. Let's see, we decided by the jawline. Forehead. good enough. Alright, human. I believe our exam is complete. I'm sure you'll make someone very, very happy, despite your less than preferable blood makeup. You can head out there and they'll begin the taste testing. Try to remain calm. It will make it easier for everyone that way. Don't linger in here. I have dozens of other humans to get to.